Hi, good morning, Mason. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 30th of October 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Mason O'Connor.
All right, Mason, could you please confirm your candidate number?
Yes. My candidate number is 432111234.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How do you approach working with individuals who have diverse medical needs?
I am not just comfortable, but highly proficient in providing care to patients with a wide range of medical requirements. Recognizing the uniqueness of each patient, I invest time in understanding their specific needs and preferences. Building trust and rapport is my top priority to ensure each patient receives the best care possible. My familiarity with various treatment options and medications allows me to quickly determine the most appropriate course of action for each patient.
How do you handle disagreements with patients or their families regarding your diagnosis?
In the event of a disagreement about my diagnosis, my approach is centered on active listening and open communication. I take the time to carefully listen to the concerns of the patients or their family, aiming to gain insight into their perspective. I maintain professionalism and respect throughout this process. Following this, I provide a clear explanation for my diagnosis, supported by medical literature, to justify my decision. If appropriate, I may suggest further assessments, or facilitate a referral to a specialist for a second opinion.
What's your strategy for managing a high volume of patients effectively?
Effectively managing a high patient volume relies on prioritization and efficient resource utilization. I begin by assessing the urgency of each case, ensuring immediate attention to critical situations. I then create a comprehensive plan that includes appointment scheduling, coordination with other healthcare providers, and a seamless patient flow. With meticulous record-keeping and diligent follow-up procedures, I aim to provide every patient with thorough and high-quality care.
How do you handle patient resistance to your treatment plans?
Dealing with patient resistance requires a patient-centered and empathetic approach. I start by actively understanding the reasons for their resistance and respecting their perspectives. By actively listening, I uncover potential concerns. With this insight, I tailor my communication to address their apprehensions and clearly explain the benefits of the proposed treatment plan. Together, we explore options to ensure the patient is engaged and well-informed about how the plan can positively impact their well-being.
Describe your process for documenting patient interactions.
Meticulous documentation of patient interactions is integral to my practice. I begin with a comprehensive assessment that includes medical history, current medications, and relevant details. This foundation allows me to create a personalized care strategy. During patient interactions, I record essential information such as symptoms, administered treatments, and follow-up instructions. Afterward, I review and refine my notes to ensure their accuracy and completeness. This rigorous documentation ensures a seamless continuity of care and informed decision-making.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Thank you, Mihiraa, for cooperating with your mother's assessment. Well, do you have any specific concerns about her health?
No, I do not have any specific concerns. I believe she is in good health and appears to be the same as she was previously.
Mihiraa, after conducting an examination of your mother, I regret to inform you that I have detected a stage 1 BEDSORE. It's important for me to ensure that you are fully informed about her condition and to address any questions or concerns you may have. Additionally, I would appreciate hearing your perspective on what you understand about bedsores.
Well, I have heard about the bedsore, of course, but there might be other things I am not aware of.
Thank you for your concern. Let me share some additional information about bedsores. A stage 1 bedsore is an early indication of skin damage. At this stage, the affected skin appears red or pink, and though there isn't an open wound, it can be quite tender to the touch. Bedsores, also known as pressure ulcers, can result from various factors, primarily a lack of sufficient blood flow to specific areas of the body. This reduced blood flow can lead to damage in both the skin and the underlying tissues. In more severe cases, it can even progress to open wounds. Another significant contributing factor to the development of bedsores is poor movement and limited mobility. Individuals with mobility issues are at a higher risk of developing these sores. Furthermore, moisture on the skin can exacerbate the formation of bedsores. Whether it's due to perspiration, incontinence, or other factors, it's crucial to acknowledge the discomfort and potential embarrassment associated with skin wetness. Recognizing these issues and understanding the possible complications is essential to providing the best possible care and support for individuals dealing with bedsores. Your compassion and consideration in this matter are deeply appreciated.
Oh, I see. But what could be the reason for my mother's bedsore?
Mihiraa, I understand that your mother's situation is concerning, and it's essential to approach this with care and compassion. Let's explore some potential reasons behind the development of your mother's pressure sore. Firstly, reduced mobility can be a significant factor. Dementia often results in a decline in a patient's ability to move or reposition themselves, which, in turn, increases pressure on specific areas of the body, making them more vulnerable to bedsores. Moreover, impaired sensation is another issue. Dementia can diminish a patient's ability to sense discomfort or pain, leading to a lack of awareness regarding the pressure and friction that can cause bedsores to form. This unawareness can be detrimental to their well-being. Additionally, the difficulty in communication that dementia patients often face can pose a challenge. They may struggle to express their discomforts or needs, making it hard for caregivers to identify and address potential issues like pressure ulcers promptly. This communication barrier can delay necessary preventive measures. It's crucial to remain vigilant and take steps to prevent bedsores from developing, and I'm here to support you through this difficult situation.
We don't want it to get worse. What can we do to prevent it?
I'm glad you're asking. Preventing bedsores involves several tasks. Firstly, it's essential to change your mother's position every few hours to relieve pressure on the affected area. This can be done by gently shifting their body or using specialized cushions. Second, maintaining good skin integrity is crucial, which includes keeping the skin clean and dry. Use mild, pH-balanced soaps and moisturizers to prevent skin breakdown. Lastly, ensuring a well-balanced diet with proper nutrition is vital, as it helps the body heal and maintain healthy skin. Adequate hydration is also essential for skin health.
I'll make sure to do that. What should I look for in terms of improvement or any potential issues?
That's a good question. To monitor the progress and detect any potential issues, I'll schedule another visit in 2 days' time. During that visit, I'll re-examine her bedsore and check your mother's skin condition. We'll also discuss any changes in her overall health and if she has been experiencing any discomfort. This will help us track her progress and make any necessary adjustments to the treatment plan.
That's great. Thank you for your help, nurse. I appreciate your care and guidance.
You're very welcome. It's essential to work together as a team to ensure the best care for your mother. If you have any more questions or concerns before my next visit, please don't hesitate to contact me. We'll get through this together.
Thank you for your support, nurse. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.